First ever global ministerial mental health summit begins in London today, amid growing warnings that Europe's youth are not getting the help they need once they turn 18. 1 in 5 deaths of 15 to 19-year-olds in the EU comes from intentional self-harm. Mental health problems account for 30 to 40% of chronic sick leave within the EU, and 450 million people worldwide are affected by behavioural and mental health problems. Well, we're going to talk a little bit more about that, and to do that we're joined by Dr. Mike Drayton, a clinical psychologist in London. Thank you very much for joining us on the programme, Dr. Drayton. This is going to be a high-profile event in London. The Duke and Duchess of Cambridge are attending, amongst others. Do you welcome this effort to try and raise the profile of mental health?
Very much so. I think one of the main problems, one of the main obstacles to helping people with mental health problems is stigma. And I think the royal family, the Duke and Duchess of Cambridge and Prince Harry, have done a tremendous job in reducing stigma and helping people talk more openly about mental health difficulties.
A lot of the funding in mental health goes into curing once a mental health issue has been identified. Do you think more funding should be going into prevention?
Yeah, of course. I think in two areas in particular. First of all, mental health in the workplace. As the statistics you put up on the screen earlier showed, 40% of sickness absence is due to poor mental health. But by the time people go off sick, it's often kind of too late to do anything about it, So training in managers in how to recognise the early warning signs of mental health is useful. But I think perhaps more important than that is early intervention with young people. I mean, I used to work in an early intervention service that was targeted young people specifically.
We know that funding into mental health is often mental health professionals often want more of the funding. Is there a real issue with what we understand about how the mind works? When someone sees a broken leg, it's very obvious what's happened. But in terms of trying to understand what is going on inside a mind, is that where we need to focus research and funding?
Yeah, I think it's about opening up a dialogue with people so people can talk openly. I mean, it's a massive problem. I mean, a quarter of people watching this programme are likely to be suffering with a diagnosable mental health problem. And as you say, it's easy to see a broken leg and people have lots of sympathy if somebody has a diagnosis of cancer. But it's not always the case with people with a diagnosable mental health issue.